Hi there, I'm Dr. Guy Carnazza, and I practice in the town of East Rockaway, New York. I'd like to welcome you to discover what's possible. Today I have a treat for you of a case that we recently completed on a 69-year-old female patient who came to us with the chief complaint that she was unhappy with her lower set of teeth. She was actually wearing both an upper and lower denture. Her existing upper teeth were fine, but it was her lower denture which was what she was not very comfortable with. She had actually had all her lower teeth removed and was wearing what we call an immediate denture. The denture was lined with a silicone material to help the tissues heal after the surgery that she had completed. The patient wasn't very happy with the fit of the denture. It was very bulky to her, and she just wasn't comfortable or satisfied. So, upon further examination, we studied the mouth and we were able to offer the patient an alternate solution of what we call an overdenture, which is basically like an implant-supported denture. And I'd like to share with you how we did that today. So let's get into it. So what we did was we examined the patient and with a dental CT scan, evaluated the jawbone to see if she had both the height and width to place dental implants. And after reviewing the scan, we were able to determine that there was enough volume of bone to place 2 implants, which is what we did. And then after about a period of 3 months, we allowed the implants to integrate or bond to the bone. And then we tested them to see if they were able to then be loaded or restored, in which they were. So at that time, we uncovered the implants and we placed what we call locator attachments, which are these golden studs that you see here. And these attachments are what the denture, the new overdenture, actually sits on top of. In the overdenture itself are what we have called attachments that actually snap into the housing. We like to say what you see in the mouth would be considered the male part of the attachment, and in the denture, the female. So these locator attachments come in a variety of retentive strengths. Blue being the least retentive, pink being a mild retention, and clear being the most retentive. And we started the patient with the the pink retentive housing first, but it was too tight for her. So we switched it out and placed the blue housing or the blue locator. As you can see, it's embedded in the denture, and what the patient does is actually snaps the denture over those golden stud attachments. And this allows for the denture to be stabilized and stay put in the mouth without any use of adhesive or any glue or any type of wafers of any kind. The implants retain the denture with the locator male and female attachments. So here is the actual final implant overdenture in place. We don't have to cover or have as large a denture with large flanges like we would have to have with a traditional denture. We still have to have some of the soft tissue support the denture, but not as much. As you can see, the flange is not as long as her previous denture. What I mean by the flange is the extension of the denture itself, the pink portion. It is less long, not as long, which gives the patient a much greater comfort in her mouth, much more freedom to move about in her mouth. In this view, we can see the before, where the denture is very big, very bulky, constricting her tongue. That's on the left side. On the right-hand side, we see the new overdenture. See the difference where the tongue has more freedom to move. That lends to greater speech, greater ability to chew, greater comfort. The patient was so excited with her new set of teeth. She couldn't believe how well the denture actually snapped and retained. She was so used to having to put adhesive and glue for so many years that this was a world of difference for her. And the extensions of the denture were not as wide or long, like we said, so she wasn't having that irritation in her cheeks and just a better quality of life. Now, it is still a removable appliance, but it is not the same as what she had before. It's much stronger, much more stable, and much more comfortable. And in the end, the patient was very, very happy with the end result, as we were as well. So, that's Discover What's Possible. If you'd like to learn more about implant dentistry, you can visit us at carnazzadental.com and see a lot more before and after cases like this. Or if you're in the greater New York area, we are located 20 minutes from JFK International Airport in the town of East Rockaway. Come on in, we can do a free consult, or you can call us and set up a consult, and we'll be happy to let you know what we can do for you with implant dentistry. Again, this has been Discover What's Possible. I'd like to thank you for joining me today, and we'll talk to you soon. Thank you.